Respiratory illness is expensive, especially prolonged respiratory illness is very expensive. So that's a reasonable size hit. On the other side, what's probably a bigger deal now in terms of health spending is the reduction in spending because we're not using elective and urgent care, what we were talking about just minutes ago.
And now you can prescribe treatment for addiction disorders by telehealth, even by telephone, even for new patients. So that's one to watch. But it's been very important during the pandemic that those flexibilities were rolled in.
So we've seen the headlines from the US to Singapore and China. There are alarming numbers showing minorities and low-income individuals have a higher death rate at the hands of the novel coronavirus. This pandemic magnifies what we've been seeing regarding health outcomes, shining a brighter light on health disparities.
How can we be proactive as an industry preparing for a long-term low interest rate environment? What actions can insurers take and what questions do they need to ask to make sure that they're ready?
I think carriers have come to embrace their accelerated or automated underwriting techniques. They've extended the face amounts a little bit, and they're looking to use electronic information, whether it be electronic health records or prescription checks or whatever else they can find, along with a fairly recent full physical with labs, say a year or 2 years old, and be able to make assessment on some of the lives they otherwise would have to postpone.
One analysis in the report it compares the past flu seasons to COVID-19. And the reason we thought this would be interesting to do is because if you know how your experience played out during past flu seasons, you can track how COVID-19 is comparing to those seasons and then get an estimate for how your COVID-19 experience may play out.
The lessons that we distilled down are really the following. Learn to embrace change. We never really came out the other end of that initial few years where we were hoping to get to having data for a stable population and then apply it like we normally do as actuaries going forward in pricing. We've really seen further changes and disruptions pretty much consistently throughout the life of the ACA.